24-year-old male patient, Tabo, presents to the emergency unit with profuse diarrhea, abdominal cramps and vomiting after eating a takeaway chicken. What could this be? Hi, you are watching ED Files and I am Dr. Tabo Mafa. Acute gastroenteritis is very common worldwide and it can cause morbidity, especially in vulnerable populations. What is gastroenteritis? This is inflammation of the lining of your stomach and intestines, which tampers with absorption of food and fluid from your alimentary tract. Now let us look at the risk factors. The infants and the elderly people are the ones which are mostly vulnerable to gastroenteritis. Other factors could be contamination of food and water, and also traveling to high-risk areas. Patients with weakened immune systems are also at risk of getting gastroenteritis. And now, what are the causes? Gastroenteritis can be caused by bacteria like E. coli or viruses like rotavirus or even parasites. Let us now talk about investigations. The diagnosis of gastroenteritis is based on history and clinical examination. We can also do blood tests such as infection markers, white cell count, CRP, which is your inflammation markers. You can also do your kidney function test, urea, creatinine, and electrolytes. You can take a sample of the stool to the lab for cultures to check what bug is there. How do we then treat a patient with gastroenteritis in the emergency unit, especially if they look very dehydrated? You put up a drip, rehydrate them as soon as possible, start them on antiemetics to stop the nausea and vomiting, give them antispasmodics to relieve the abdominal cramps. If we suspect there is infection, you can start them on antibiotics as soon as possible. Last but not least, give them probiotics. What could be the possible complications if this condition is not treated? The patient can have severe dehydration, electrolyte imbalance, kidney injury, and sometimes sepsis. Now, what was the outcome for Tabo? He was stabilized in the emergency unit, rehydrated, given antiemetics, and he recovered very well. He was discharged home that day, where he made good progress at home. In conclusion, early recognition of signs of symptoms of gastroenteritis and commencement of treatment as soon as possible can save a patient's life. And thank you for watching. See you in the next case.